All right, well, let's jump in and get started because we value your time so much. And this is such a treat to do a lunchtime chat with two of my friends and colleagues. I'm so excited to be in the same space as you. Welcome to our conversation about at-home IUI and the role that acupuncture and midwifery care can play in creating an emotionally supportive and also clinically optimal experience. So we're super excited to be here. I think this is an area that is not talked about enough. And I think everybody who's participating in the conversation today feels really strongly about increasing access to education in the preconception space. So we're really excited that Yinova invited us to be part of the community today and share in this conversation. So I just wanted to start by introducing myself. My name is Casey Selzer. I am going to be moderating the conversation today and jumping in with my point of view. I am a certified nurse midwife, and I'm also the founder of ParentCraft, which is a midwifery guided educational space that provides preconception, pregnancy, and postpartum support based in Park Slope, which is where I live and raise my three kids. I have three daughters, two of whom are identical twins. So that's part of my journey and lens that I view everything. And I've worked in both public health and private practice in New York City since moving here in, 2005, dare I age myself, to attend midwifery school at Columbia. And I've also been the co-chair of the New York City Midwifery Chapter, which is a part of NISM, our national and state organization. So one of the things, I'm going to introduce our other panel participants in just a second, but one of the things that I really hope that we can talk about and explore today is this importance of building our health literacy in all aspects of fertility and pregnancy care. I think as I've gone through my journey as a clinician and now as I've transitioned into the educational space, one of the challenges I found is that traditional childbirth education is problematic in that people don't access the information until pretty far along in their journey, right? Like a lot of people think of like kind of taking a childbirth education class as a third trimester kind of check to-do list, right? And so much, at that point when you're, at 28 weeks pregnant, you've already been months, maybe even years going through your own journey. And so one of the things that I've been offering at ParentCraft is a class that I call the Seed class. And it is an opportunity to work with folks in the preconception phase to help you understand more about kind of what is the New York City birth landscape, how do we give birth here? And then who are the helpers on your journey, wherever, like I meet you at whatever phase in the process you're at and help you find the right fit for care providers, both your clinical care, as well as allied health providers as well. And so it's been really, really rewarding, the feedback that I get from working with individuals and couples in that phase of the process, because it's such a vulnerable space where we often go, we need so much support and community, and yet we often culturally kind of go inward more. We find ourselves, Googling things, and that's not always the most supportive way to learn about evidence-based care and resources and community. So that's something that I've been working on and hope to continue to build in my work. And one of the things that comes up a lot is that there's different ways to make babies and that everyone's journey to parenthood is unique. And so it's been such a privilege to be able to collaborate with and refer to Chloë in her practice. And so I want to give a little intro to Chloë, and then we'll jump into here a little bit about what is at-home IUI, which is our theme for today, and how can midwives and allied health clinicians support that work. So just a little bit about Chloë, because I'd like to just, brag on about her. So she is a certified nurse midwife and a reproductive healthcare nurse practitioner who has been in practice since she graduated from Yale in 2014. she has worked in both public health and private practice as well. We have overlapped in some of our journey together as midwives in New York City. And now she attends births at home through her solo practice called Cosmos Midwifery. And you may follow along on her an incredible and renowned blog and her Instagram handle, The Midwife is In. That she's here today. We're so excited. So Chloë believes really strongly that midwifery is how she makes her contribution to the world a better place. And at Cosmos Midwifery, she's offering home birth and GYN services, fertility consultations, at-home IUI, and gender-affirming hormones for TGNC folks. And Chloë is joining us from Greenpoint. So welcome, Chloë. We'd love to hear a little bit about what your work and unpacking what is at-home IUI.
Well, thank you so much. It's such a pleasure to be here. I was just saying to Casey before we started that I can just talk about this until my face turns blue. It's my favorite topic. I love being a midwife, and I can talk about that a lot, but one main reason why I love being a midwife is because I can work in the birth world and also in the fertility world, and do that in a way that I know makes a really big difference for folks. The Cosmos Midwifery in its current form is a home birth practice mainly, but I also do a lot of work with folks who are trying to become pregnant, either through penis and vagina sex or through IUI or through even IVF, although I'm not actually providing the IVF. I can do work on the front end to help them optimize and boost their fertility. So my role in fertility work is to start with a very long intake visit. Sometimes it's 2 hours, sometimes it's longer, that it goes through every step of someone's life: how they sleep, how they eat, how they exercise, what their work week looks like, all of these different things, as well as their health history. And then I counsel them on how to track their cycle, and what recommendations I have for improving, or really, I mean, the word optimize is kind of ideal, because everybody who wants to be fertile has a level of fertility already, and it's just mostly, and I'm sure we'll hear a lot more about this when we hear about the acupuncture side of things, it's just mostly about bringing people into neutral, is sort of how I think about it, bringing their body into the optimal state of health so that their body can do the work of releasing an egg at the right time. And then I also talk about timing, and so timing is different depending on what kind of sperm you're using. But for IUI, what that means is that either people are using fresh sperm, which has been washed at a lab, and then they bring it home to their house or to my office, and I do the IUI, or they're using frozen sperm, which comes in these giant tanks, and we defrost it and use it right then. And so at home IUI, I mean, IUI is a very simple process. The procedure itself is very quick. It's we place a speculum, put a really long, thin, soft, and flexible catheter through the os of the cervix. So that's the opening of the cervix. And you put the sperm where it needs to go, which is up into the top of the uterus, so it's as close as possible to where that egg is. And you want to be able to put it there at the perfect time, especially if it's been frozen. And I can get into depth about that if you think that's useful. But basically, that means that I go to someone's house and I'm there for about 30 minutes max. And during that time, the majority of those 30 minutes are me taking my shoes off and putting them back on again. So very quick and simple. And then I leave and I ask them to keep their hips up for about 60 minutes and just rest and, be peaceful and centered if you want, or watch TV if that's better, whatever. And then I keep my fingers crossed to hear good news.
Awesome. Thanks for sharing that. And I already have a lot of questions, and hopefully our participants today, we want to make sure you guys that this is a casual lunchtime chat. So if you have questions that pop up as anyone's chatting, just put them in the chat for us, and we'll really do our best to get to all those questions as well. So feel free to add those at any time. So let's chat with Mary for a little bit, and then we'll kind of get into some of the more nitty gritty stuff as we go. So I want to introduce to everybody Mary Hamawy. I got it right, Mary, right? I've been working on, known Mary a long time, and I'm always struggling on her last name, but I think I got it. Mary is the clinical director of the Brooklyn location of the Yinova Center. And Mary came to Chinese medicine work through her own journey of fertility and the birth of her daughter. And she has a passion for Chinese medicine as it applies to the childbearing experience, particularly with a focus on postpartum care, which we all know as clinicians is an often vulnerable and neglected space in the traditional medical system. And Mary also has a lens of prioritizing the need to protect the health of the whole family by focusing on the birthing person first. And Mary attended Amherst College in Princeton and acupuncture school, and now lives in Park Slope. Welcome, Mary. We'd love to hear a little bit about your point of view on this conversation.
Thanks, Casey. Thanks, Chloe, too. And it's real privilege and treat to be with you both. The education that you both provide is just so important. And we all know that so many people have a range of obstacles that they have to go through in their fertility journeys. And you both make that so much easier and give people the information to have their own agency about this whole experience. And so I'm really excited to talk about the Yinova Center, but we really appreciate what you guys do. So thank you for that. In fact, what we think in Chinese medicine is that the more information you can give someone about their bodies and how to come to balance. Chloe used the word neutral, we say balance, or the Western term of homeostasis, but that's what we're looking for, is to get people at their optimum place. Just a little bit about me. As Casey mentioned, I came to Chinese medicine. I had a very complicated gynecological history, and doctors were sort of shaking their head about my options. And I had read a book about Chinese medicine and fertility and asked my doctor, can I go try this for a couple months? And I did. And I worked through what we call whole systems Chinese medicine, which is optimally a 3-month period where you experience treatments through acupuncture, herbs, dietary advice, exercise advice, meditative advice. And 4 months later, I was pregnant. And so that was my miracle baby, is now 9 and is a classmate of Casey's eldest. And so it's something that I'm really passionate about and hold dear to my heart, as most of us here at Yinova do. We are a fully generalized practice that treats everyone from newborns to 90-year-olds, everything from back pain to emotional issues. But we all have a particular specialty and love for reproductive medicine and GYN. And that's in part because our founder, Jill Blakeway, wrote a groundbreaking bestseller book 10 years ago called Making Babies, which really changed the way acupuncture treats fertility patients. And she wrote it with a reproductive endocrinologist. So you have both kind of viewpoints exhibited in the book. And it's a really helpful read for those of you who aren't familiar with it. And we've been doing this since 1999. I've been the clinical director in Brooklyn for the past year and a half, but I stand on some pretty impressive shoulders. And we, as I mentioned, we have this idea of whole systems, that we look at the whole person, where our intakes aren't quite as long as Chloe's, but pretty close, and that we go through all systems head to toe. We dig into the gynecological history, but we want to know about your seasonal allergies, and we want to know what makes your stomach get upset, and do you have an achy knee? And all of those feed into how we view you as an entire system that's unique and special, and we can tailor our treatments to you and the outcomes that you would want to see. And what we do is that we're rooted in this ancient tradition of Chinese medicine, but we also are really dedicated to measuring our own outcomes and managing cases in a way that we track what's happening so we can take you as far as you need to go. And because of this mix of tradition, but also being very studied in the Western procedures, we have good relationships with doctors throughout New York in the birthing world. And so we like to help be translators to a certain extent of what's going on in your Western treatments and how we can help. So I'll leave it there for now. Specifically for IUI, can kind of highlight, studies have shown that acupuncture can help by improving endometrial morphology, so that the shape and effectiveness of the cells in the endometrial lining. It promotes microcirculation of the endometrium, so things are moist and juicy and ready to receive what it needs to receive. Regulating estrogen to support a healthy lining as well. When you're closer to the actual procedure of an IUI, acupuncture can help open the cervix, and so there's less discomfort when the catheter is inserted. And then we can also promote blood circulation throughout the pelvis, again, to help implantation. So.
Amazing. I'm learning so much already. This is incredible. Okay, so I'm going to jump in and ask a few questions to get a little bit more information for our participants today. And again, just if you have any questions, those of you who are joining, feel free to drop them in the chat and we'll do our best to get to everyone's questions. So I want to start with Chloë. Why at-home IUI? What are some of the benefits to doing this procedure at home versus in a more mainstream medicalized clinical situation?
I mean, first of all, it's just so much nicer. It's so lovely to be able to be in someone's home in their safe space where they've lit candles or have, their pets with them. It really takes the stress level down. But also a lot of the people who I work with for IUIs are queer and trans couples who are not infertile.
Mm-hmm.
And they do not need to be in an infertility clinic. And even the couples who have both sperm and egg in the same relationship, they are oftentimes they just need to get the sperm where it needs to go. And so that's not so much a medical process. It's not like IVF where you need to have lots of hormones and medications and ultrasounds and blood draws and all of this stuff, and then things going in places where it's a surprise for them to go. So it's really nice to be at home and to be able to treat it just getting the sperm where it needs to go. And also in a clinical setting, things are moving a lot faster. And so the majority of the places that I know of only have time and space in their clinics to allow people to stay reclined for 15 minutes. But we see in the research that it does improve pregnancy outcomes to stay reclined with hips up for at least 60 minutes. And so that's something you can really take your time doing at home. Mm-hmm. Also, timing wise, it would be great if it did, but ovulation doesn't happen on the work week calendar. And so if over the weekend at night, I do a lot of IUIs late at night after the older child is asleep in bed, and that's it just fertility is such a I don't know, it's just such a life cycle, just like everything else. It's less about illness most of the time and more about getting to balance. Balance is such a better word than neutral, but the finding the balance of your life cycle and, optimizing that and putting the sperm where it needs to go in that moment.
That makes total sense. And like creating that space where people can really be comfortable, where, I mean, that is where they are at home, is the most comfortable space. So that makes total sense. So Mary, we'll kind of like ping pong and just kind of get some questions from both of you. So say I'm planning to, attempt at-home IUI with Chloë. Like how often, like when should I come see you? Where do you fit in? Like how often do I need to come in? Do I need to see you before I even get started with the conversation with Chloë? Is it sort of in tandem? What is sort of the flow of visits and kind of logistically, like how would I access your care during that phase?
So what ideally we revert back to that sort of 3-month period of it takes usually that amount of time for things to adjust and habits to change to optimize your fertility health before you get started. That being said, we realize that this is New York in 2021 and who's got that kind of time? So we want to be able to meet people wherever they are in their schedule. And so if you have time for a lead up, that's fantastic. If you call us the night before your procedure, you can come in. We do home visits, so we can come visit with you beforehand. It's really whichever way fits best. Ideally, we see you weekly for a set amount of time beforehand, and then we see you weekly after just to support whatever might be going on. But again, if you can't afford the time or the energy or the money to do that, then we can make it work and we can set a plan that works for your schedule.
Mm-hmm. That's fantastic. Awesome. So Chloë, would you be able to kind of talk us through, you did a little bit in your intro, but kind of, you talked about how it works, right? Can you share a little bit more kind of illustration about the experience, like, and what kind of most people, what is the patient experience like? What do your patients report back? What's it like? What's it going to feel like? Is it emotional? Is it physically uncomfortable? A little bit about kind of some texture to the experience.
Assuming we get the timing right, it's not uncomfortable at all. People really barely notice it. And that's a generalization, but
right.
What happened, so I show up and people are usually sort of like nervously pacing. But what we do is if they're using frozen sperm, which many people do, we start by opening up the tank and taking out the sperm. It's this gigantic metal tank with dry ice in it. So you open it up and steam comes out, and it's very sci-fi. And you pull up this long dipstick and out comes just this tiny little vial of sperm. It is this big. And I take it out with gloves because otherwise you would burn yourself. And I hold it until it's warm enough to touch with your skin. And if, and I said earlier, I was talking about couples more, and I do often work with couples, but I also work with people who are getting pregnant on their own also. So I either hand it to you if you're the one who I hand it to whoever's there, and they hold it and they warm it up and they put all of their love and intention. And during that time, I get my stuff set up and I chit chat. I have them set up, 3 or 4 pillows on their bed. If they want to put a towel down, they can. There's not a lot of leaking. But then when everything is warm and liquid, then I'll draw it up into my catheter here with a little syringe. And I have them get onto the pillows with their hips up on the pillows so that it's almost like when you're in a you know, a medical office and you're scooted down to the edge of the table. And then I put on my spelunking lamp, my headlamp, because that's the easiest way to see where I'm going. And I use a speculum. Oftentimes I use a metal speculum, but plastic is fine too, depending on people's preference. And the reason why I use a speculum is so that I can see where I'm going. That's what it does. It just holds the tissue out of the way so I can see the cervix, which is the opening of the uterus. So I place the speculum so I can see that cervix at the end. And no one loves having a speculum in place. That's just a fact of life. But my goal is always to make it as comfortable as possible. And for, you know, if it's more comfortable for you to place it yourself, I'm happy for you to do that. I can sort of guide for the angle, for the view, and then you can place it. A lot of my clients use a mirror to watch what I'm doing. But once that's in place, I can see your cervix. And once the speculum is in place, you don't really feel as much discomfort. You feel like it's there, but it's not pinchy. It shouldn't be super, like, a lot of pressure. And one thing that I've done is that I've asked my clients to actually have an orgasm before I get there, as close to the time that we're going to do the IUI as possible before I get there. And one really cool thing about the uterus, there are a lot of them, but one of my favorite facts is that during a menstrual cycle, during a period, the uterus cramps from the top of the uterus, the fundus, down to the cervix to try to get endometrial tissue, period blood out. But in an orgasm, it cramps from the cervix up to the top, and it ripples up toward the ovarian tubes, which are where the egg is floating. And so and that actually lasts for hours after an orgasm, although it's strongest right afterwards. But that is it's helping what we want to do. So it does that, but it also softens and opens the cervix even more. The cervix is tightly closed when you're not fertile, but at ovulation, it's soft and a little bit more open. Never enough that you could like put a finger through, but enough that it should not be painful to put the catheter through. And usually the catheter just slips right through, easy peasy. You feel like a weird, like twangy, maybe a little bit of like a pap feeling of like, ooh, that's weird. But it shouldn't be painful. And then at that moment, I stop, and either if that person wants to be the person who's getting pregnant wants to be the one to push the plunger down, or if they have a partner there with them who wants to be the one to push the plunger down on the syringe, they can do that. It takes about this long. And then you're done and everything comes out. I take out the instruments and then you just keep your hips up for a little bit longer. Snuggle in bed.
Amazing. It's so helpful to hear that demystified for folks, I think, and also to compare, be really interesting to compare what people hear about the experience in a clinical setting, and how that might be, you know, more supportive is certainly illustrated by the way that you're describing that. So that's super interesting. Mary, I thought it would be cool to hear a little bit about like the different modalities that you use in supporting the IUI process. I think, you know, we think of like acupuncture, we think of needles, you know, as a general population. What if you hate needles? Is there something else that you could use? Do you use herbs in this situation? Like what types of different modalities would you be kind of exploring with an expectant person?
So yes, we are not just needles. And if you hate needles, still give us a try because they're teeny tiny and they don't hurt and they feel real good. So keep your mind open to acupuncture if you've never tried it before, but you still have an aversion to needles. But we do have other tools in our toolkit. And I apologize for the barky dog in the background. I have a puppy who likes to chase our cats. One of our major options when we're dealing with fertility patients is Moxibustion. And Moxa is a very warming herb that's picked at the height of summer to get even more warm, and it's dried and formed into a bit of a cigar shape. And we use that to warm and increase circulation on certain spots. And in the fertility world, its biggest claim to fame is it helps us turn breech babies, but we also use it way ahead of that to promote follicle growth and to also promote lining improvement as well. So we can do that over your belly and over the ovaries and get you ready in that sense. It's very soothing, it's very meditative. It's just a nice way to relax as well as to promote those things. The other option are herbs. We generally, if the cycle is medicated and you are taking hormones, then we don't prescribe herbs usually, mainly because the hormone medication is so strong that would pretty much override anything our gentle little herbs are trying to do. That being said, if you're having a particularly poor reaction to the hormone medication or having really nasty side effects, we can help you with herbs a little bit that way. What we do when we do like to prescribe is sooner. If you have that, again, the magical 3 months, that would be part of the treatment there, or even one cycle ahead of when you're planning to do the IUI. If you're on an unmedicated cycle, then absolutely, we prescribe herbs according to you and the whole sort of picture that we have of you, but then also mapped on top of that, we prescribe according to what you're doing each week of your cycle and to promote those particular activities, be it follicular growth or promoting ovulation or supporting in the luteal phase. So we have other modalities, things like cupping and gua sha, which I can get into if people are interested. They're more releasing. And so usually in these cases, we're trying to build a little bit more, but if you find a person that's very sort of stuck and tight, then we can help with those modalities as well.
Interesting. Cool. Thanks for sharing that. I wanted to ask about IVF, right? Our focus is IUI today in the conversation, but you know, I'm curious to include. I want to be inclusive in the conversation and talk about, you know, for both of you, what are and we can start with Chloe. You know, what are the different ways that you're, you know, it's obviously you wouldn't be performing that procedure, but how do you work with, you know, at what point do you determine you're moving on from your, you know, your at-home IUI, moving into the IVF space? And then how do you provide support during that transition? Might be a question that some of our attendees might be curious about.
It's a very complicated question, but I'll just say briefly that so the benefit to working with me while you're doing IVF is that I'm very similarly to Mary and acupuncturists, as I'm working with your holistic health and hoping, you know, recommending herbs and supplements and things to do and ways to live your life to decrease stress and decrease the load of work that your body has to do in order to help it focus its energies on growing some healthy, beautiful follicles to collect for IVF. And then also once you do the IVF transfer, the embryo transfer, to help you hopefully stay pregnant and have a healthy full-term pregnancy. But I always start with people with unmedicated cycles, or I say always, most of the time, unless they're coming to me from having already been doing medicated cycles and want to continue doing that. Unmedicated cycles with me means watching really carefully what your body's doing, using herbs, using supplements, and all the things we've been talking about, and acupuncture, one of my favorite tools. And then and working on just following your body's lead. If we do that for a little while and you decide, you know what, actually I'd like to try some medications, we can still, I don't personally prescribe medications. I know some midwives who do. I also know some reproductive endocrinologists who I love and trust and will refer you to. And you can continue to do at-home IUI with me, just doing the medications with the providers and then doing the IUIs at home with me. And then, you know, the research shows that with well-timed IUIs, the average number of cycles that it takes to become pregnant is 4. Now, average means nothing when it's you, and it's not like it's a fertility bank. You're putting a quarter in each cycle and cha-ching, you hit 4 cycles, you should get a baby now. An average is an average, but it's a good number to have in your brain, at least in terms of, okay, it's very, you know, if I hit 4 and I'm still not pregnant, that's really okay. That's really within the realm of normal. The research shows us that it's reasonable to go up to 9 cycles of well-timed IUI. It seems like a lot of money and energy and emotion for me. So if, of course, any of my clients want to stop sooner, I fully support them. But whenever it feels like it's, if they're not becoming pregnant with the IUI, whenever it feels like it's the right time, I can refer them to an REI to move on to IVF.
Okay, awesome. That's super helpful for everyone to hear. Yeah, Mary, would you want to jump in and add a little bit about kind of how you might support people if it's different, like, you know, how you support people through IVF, if it's different from what you've been sharing, or the ways that it's different?
Mostly it's different in the timing of the treatments, because IVF can be so regulated. We try to match each step of the way. So during the follicular phase, we like to see folks twice a week just to kind of give that ongoing boost. And again, apologies. There's also a timing question right around both procedures, both retrieval and transfer, that we like to see people within 24 to 48 hours before the retrieval, just to give the follicles one extra boost. And then at transfer time, we like to see them that same period of time, 24 to 48 hours before, 24 to 48 hours after, to just hold and contain what the embryo is doing. So it's a little more fussy, I would say, just because patients by that point, you know, they've tried usually IUI and various other modes, and so we want to really support them as closely as possible. IUIs are a little more relaxed just because people often, you know, the success rates can be really pretty wonderful. So we just hand in hand, week by week, we support you that way.
Okay, awesome. Thanks. Chloe, I have another question. Sperm. Can you demystify sperm a little bit? You know, if you don't have sperm in your birthing relationship, or, you know, in your partner's body, or you don't have a partner and you need sperm to materialize that conception, you know, can you just kind of walk us through a little bit, like, where does one get sperm? How do you get it? Is it expensive? Is it cheap? Is it easy to get? Is it a complicated process? That might be an interesting thing to hear a little bit about.
There are pros and cons to all of the different ways to get sperm. Probably the most low budge way to do it is that you find somebody who you know and trust and hopefully love very much, or actually just think is a cool person, and you ask them to donate sperm. If you are healthy and have no issues with fertility, and they are healthy and have no issues with fertility, and both of you feel comfortable that there's no issue with the possibility of STIs, sexually transmitted infections, or anything else like that, you can go the old school turkey baster method. Just get a, have the donor ejaculate into a cup, use a syringe and put it in your vagina, and great, taken care of. When you're doing IUI, you still want to wash the sperm. So that means going to a bank, making the donation, having it washed, and then either you or the donor carry it home to your house, where then I do the IUI with it. Any sperm that's being passed through the cervix directly into the uterus has to have been washed first. And then there is frozen sperm, which can be, you can work with a known donor, so someone that you've asked to donate for you, who then has gone to a cryobank and donated, and it's been washed and frozen and maybe even quarantined for a few months just in case of concerns about STIs. Then, or you can just use anonymous frozen sperm. Fresh sperm, the less that sperm has been messed with, the better it works. Sperm are little divas, and so they, if you can just let it do its thing.
We need a graphic for that comment, or a GIF, whatever would be better.
Visualize it. But if you so fresh sperm is going to last inside of the body anywhere from 3 to 5 days. So theoretically, if you are having penis and vagina sex in order to get pregnant, you could have sex on Monday and get pregnant on Friday when you ovulated, which is wild. But when you're using fresh sperm, it makes it a lot more relaxed in terms of when you have to be doing inseminations. When you wash fresh sperm, it probably takes it down a little bit in terms of the timing and its longevity. And then with frozen sperm lasts, after it's been thawed, anywhere from 12 to 24 hours. So the sperm lasts 12 to 24 hours and the egg lasts 12 to 24 hours. So you really have to time it right to get them together. So when we're talking about frozen sperm, I usually recommend doing 2 IUIs in a cycle, just to really make sure that we cover the time frame.
Mm-hmm.
And sperm is expensive. So the benefit to getting it donated from a friend is that that's free. The downside is that there is no legal way for them to sign away parental rights before the child is born. And so you can go to a lawyer, you can write up a beautiful contract, they can sign it, everything is great. If they change their mind later, it's not a legally binding contract. And so I know people who've had less than optimal, friendship breakups with someone who's donated, and then there's a custody battle, which is always a shock. But that's about how much you know them and how, your relationship with them. That can't happen with anonymously donated sperm, but it costs a lot more. I think in New York, I've seen anywhere from $400 a vial to $2,000 a vial.
Wow.
So it really depends. And then people want to know, well, what's the difference? It's just about finding the right donor for you, and whatever that vial costs, you want to use it. And so when I talk about doing 2 IUIs a cycle, that's a vial each IUI. So it could be $2,000 a cycle, just with the sperm, not to mention everything else that you're doing. So it gets expensive.
Definitely. Okay, that's really interesting. Thanks for sharing that. So we're getting down to the end of our time here, and I wanted to bring it back to my passion, which is the educational component of kind of, improving our access to like basic health literacy in the, fertility phase, and, and preconception and early conception, where there's clearly a huge gap in available resources and support. So I was curious to hear from both of you as kind of a final question that I have. What are your favorite resources that you would recommend in terms of like blogs or books or practitioners, or you could just highlight one, and we're going to send a follow-up email out to everybody that signed on for the webinar, and we can include any others there. But I was just curious if there's any educational resources that you wanted to highlight that you think have helped your clients on this journey that can be often consuming in multiple aspects of your life and overwhelming. So I would love to hear that. Mary, do you have any that come to mind? You mentioned the Making Babies book. Can you put the name in the chat for everybody?
Sure. And another shameless plug. We have, I'm typing and speaking at the same time.
I didn't mean to make you multitask. It's okay. Oh,
well, Emma's on it. Awesome.
Yeah.
We at the Yinova Center have, we kind of upped our game during lockdown and developed curricula online as education and support groups for people who are looking for more information about fertility. And we developed a course that comes in both an 8-week kind of extensive, exhaustive format, and then the intensive 3-week that's actually starting when, Emma? You want to put that in the chat too? Very soon. And what it does, it goes soup to nuts. The first session is basically a biology anatomy lesson, all the stuff that we never learned in high school that we should have. And then it progresses both on a track of Chinese medicine and Western medicine about how to support fertility health. In the longer format, the 8-week format, we also have visiting speakers from the reproductive endocrinology worlds. Some of our expert friends come in and walk us through the different protocols that happen in IUI and IVF. We also get visits from some clinical counselors who come and talk through the emotional struggles of what it means to be going through fertility challenges. We have one of our Yinova folks come and talk about fertility massage. We developed a self-massage program over lockdown. We also developed an in-clinic fertility support bodywork program that follows you throughout your cycle. So that's my favorite, I would say.
Awesome. That's great. That's great to know about. And Chloe, I saw you running off to your library. Now I'm curious. I see that. I recognize the title on top.
This is the classic, Taking Charge of Your Fertility by Toni Wexler, I'm guessing is how you pronounce that. It's pretty gendered, as a heads up, if that's something that concerns you, but this is like the guide to tracking your cycle. So if you're trying to get pregnant, however you're trying to get pregnant, it's really useful to have information about how to track your temperatures and your cervical fluid and all of these good things. And this is stuff that I go through in lots of depth in my intake visit, but it's so helpful to have something like this at your fingertips to think, wait, what does it mean that my temperatures are dropping at the end or whatever? So this is a really good one to start with. So Taking Charge of Your Fertility. And then I just also grabbed this because this is the Making Babies book. I don't know if it's an old version or not. I've had it for a while.
That's great. Thank you so much.
It's a great book. I really like the way that it's set up. And here's another one that is less, start with these two, but there's also this one. It's called For Fertility. It's about hormone balancing, basically. And it's, there's so many different things to do, but I really think it's helpful to talk to someone who knows how to do this stuff, because there's no knowing what you don't know.
Mhm.
So like the class that Mary was talking about sounds like a great way to start learning and getting tuned in.
Awesome. So we're about to sign off, but I just want to make sure everybody knows how to find us and use us as resources moving forward. So again, I'm Casey Selzer, founder of Parentcraft, and it is parentcraft.org. Or you can find me on my mostly sleepy, inactive Instagram, but you can find me there at Parentcraft Brooklyn. I'm on Facebook too. And I would love to hear from anyone who is looking for an insider's point of view about how to navigate resources and referrals in New York City. And that's kind of my specialty and my passion about helping you find the right providers for you. I work with patients who work with high risk and maternal fetal medicine specialists. I work with people who are going the home birth route, and everybody in between. So, I'm here as a resource to help people kind of find their way through this space where there's not always a clear guide. So that's how you can reach me. And Mary, would you share? And then Chloe, as we sign off here, how we can find you?
Sure. We're at the or www.yinovacenter.com. And we have extensive blogs there about pretty much any topic relating to fertility and acupuncture that you can ask for. So please check us out. I think Emma's going to put that in the chat too.
Awesome.
And you can find me at my practice is at cosmosmidwifery.com. You can't actually find my blog right now because I forgot to update my credit card information on the website.
They're still gonna find you. Don't worry, you're out there.
The midwivesin.com used to exist. It will exist again. And then, but the majority of my life is on Instagram, which is at the midwife is in.
Awesome. Thank you guys so much for being here. And I just loved spending an hour with both of you in these strange COVID times. It's been so hard to see everyone. So it's just fun seeing your faces and talking about something that we're all so passionate about. And that's helping support and educate this, this space in people's lives. So thanks for being part of it and hope to do more in the future.
Thank you so much, Casey.
Bye, everyone.
Bye.